I think we're going to get started. Hello, everyone, and welcome to our Helping Families and Students Understand Their Benefits and Earning Potentials when on SSI, our workshop today. All of our workshops, including previous ones, are recorded and can be watched on the VFN YouTube channel. The link is on our website, which is vermontfamilynetwork.org. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. So a little bit of housekeeping. Today's workshop is being recorded, so please keep that in mind as you share information about your own situation. This session will include live captions. If you want to turn them off, click on Live Transcript, then hide subtitles. If you're comfortable, you're welcome to turn on your camera. You can ask questions using the chat box, which you'll see at the very bottom of your screen. So that's where a great place to be using, any questions you may have, comments, or information sharing. So helping families and students understand their benefits and earning potential when on SSI. This workshop is a collaborative presentation hosted by the Vermont Family Network and Vocational Rehabilitation. The VFN and VR collaboration. Vermont Family Network and the Department of Vocational Rehabilitation have shared a vision in supporting youth and young adults with disabilities and their families in the transition to adulthood process. We support each other's work. VFN works closely with families and their youth to help them link them to resources and agencies which assist towards developing self-advocacy skills, pathways to independent living, and post-secondary opportunities in both careers and education. Families have much to learn as they navigate systems and benefits that are available for their young adult with disabilities. Vermont Family Network can help families connect with VocRehab to learn about their options starting from the time it's appropriate to talk about transition goals in school. We're providing this information to ensure accurate, up-to-date information is available so that youth and families can make informed decisions. To introduce youth to the world of education, training, and work. Encourage families to take advantage of the benefits of youth going to work and/or pursuing education and training. And inform youth and families about available work incentives. So it's my pleasure today to talk about our presenters. Our presenters are JoAnne Lemay, Benefits Counselor at Vocational Rehabilitation, Karen Noel, Benefits Counselor, Vocational Rehabilitation, Betsy Choquette, Program Manager, Vocational Rehabilitation, JoAnne Wechsler, who's a Parent and Family Support Consultant at the Vermont Family Network. And of course, myself, Martha Frank. I'm a Family Consultant here at Vermont Family Network. On to you. Thank you, JoAnne.
Thank you. Hello, everyone. I am a benefits counselor with VocRehab, and I'm going to be talking today about transition youth and a work incentive that is out there for youth that is on SSI. Social Security defines transition-aged youth as individuals that are aged 14 through 25 who are making the transition from school to work and or to further their education. Transition-aged youth with disabilities face unique challenges in transitioning from school to work, and some may even think working is not part of their future. Next slide. So this slide, I wanted to show what happens to SSI when someone turns 18. When someone is on SSI, it is a needs-based cash benefit for people with disabilities. Social Security conducts a disability review when children turn 18 because the disability criteria for adults is different from the children's criteria. The age 18 redetermination decides if the adult still qualifies for SSI, or in some cases, a childhood disability benefit, which is a Social Security disability benefit based on a parent's record. And Social Security usually initiates the age 18 redetermination application within a year of turning 18. Next slide. The benefits of working while in school is that it increases the youth's long-term earnings potential and quality of life. Summer jobs, internships, and volunteer work can help young people develop job skills, soft skills, and gain connections with employers for the future job searches and learn about career choices. Linking knowledge gained at the worksite with a planned program of study increases school engagement, decreases dropout rates, and makes it more likely that a student will attend post-secondary education. Next slide. Can youth work when they are receiving Social Security benefits? Yes, they can. Many students that are under the age of 22 can work without their SSI becoming affected. Otherwise, their SSI would be reduced about $1 for every $2 they earn, and this work incentive is called the Student Earned Income Exclusion. Next slide. The Student Earned Income Exclusion is for youth who work and receive SSI. It allows eligible students to have more money in their pockets while they work. This means you may keep more of your SSI while you are working and using the Student Earned Income Exclusion. Next slide. What is Student Earned Income Exclusion? What it is that Social Security sets a limit each year for the Student Earned Income Exclusion. And in 2022, the limit is $2,040 per month or $8,230 for the year. That means you can earn up to $2,040 a month with no change to your SSI payment. And in 2022, you can earn a total of $8,230 during the calendar year without effect on your SSI payment. I do want to give a little bit of an explanation of why there's a difference of the limits of $2,040 versus $8,230. What happens is if the student is earning, say, $2,040, they will have only 4 months of the year, and then that exclusion will have been used because they're only allowed $8,230 for the entire year. Next slide. What are the requirements for this work incentive? They have to be SSI eligible, under the age of 22, 21 years or younger, regularly attending school, 7th to 12th grade for at least 12 hours a week, college, university for at least 8 hours a week, training courses for employment for 12 hours a week, approved homeschooling for 12 hours a week, and there's exceptions to hours and circumstances are outside of students' control. And what I do want to explain is that if they are in a college or university and they are out for summer break, or actually in high school and they're out for summer break, the Student Earned Income Exclusion is still good. It still exists for them, even though they aren't actively in school. But as long as they are going to go back to school, and that's their intent, it is still good during the summer. Next slide. And this is an example. So 19-year-old Kara is a freshman at a local college to get her bachelor's degree in chemistry. She's enrolled with 12 credits. She has a part-time job at the student center and is paid about $400 a month. This is below the limit of $2,040, so her SSI payment will not go down. If she earns this amount every month throughout the year, she will have $4,800 of total earned income. This is also below the annual limit of $8,230. Kara also remains eligible for the full SSI payment for the whole year because none of her earned income will be used to calculate her SSI payment. Kara must keep her assets and resources below $2,000 to remain eligible for SSI. Next slide. And this is another example. 17-year-old Robert works part-time at a coffee shop while he is a full-time student in high school. Robert is paid about $350 a month. This is below the limit of $2,040, so his SSI payment will not go down. If he earns this amount every month throughout the year, he will have $4,200 of total earned income, which again is below the annual limit of $8,230. For the whole year, Robert will never have his SSI payment go down, and he also must keep his assets and resources below $2,000 to remain eligible for SSI. Next slide. I am the voice of the Work Benefits Helpline. So if there is any questions and you do need help with this, please contact me at the number that's shown on the screen or the email that is shown on the screen, and I will be very happy to answer any questions or help you with any information that's needed. And that's the end of the presentation.
Thank you very much, JoAnne. Now I believe there are other resources available for folks to know about. If you have questions, please connect to the Vermont Family Network helpline or call Vocational Rehabilitation's main office line. Next slide, please. And those items are also put in our chat box. And again, as we move through this presentation, I'm going to encourage our listeners to please think of questions they may have that we certainly can be asking our presenter before we're done. So now I'd like to hand this over to JoAnne Wechsler, The Journey, A Parent's Perspective. Thank you, JoAnne. I don't know if JoAnne is muted. So let me just give us a moment.
Okay, I think I'm
Thank
here.
you. You're here.
You.
Thanks, JoAnne.
Yeah.
Hi.
Thanks, Martha. Hi. So my name is JoAnne, and I was invited here to share our family's experience related to transition to adulthood for my son, particularly as related to SSI. So Adam first applied for SSI at his 18th birthday, and I have to say he's been a pretty busy guy since. He's 25 years old now and working part-time. He has a progressive physical disability with medical complexity, but does not have a cognitive disability, and we do not have guardianship. He is an independent adult responsible for his own finances and medical care with support, but he does have many providers, a room full of durable medical equipment, and he relies on personal care attendants and his parents for most of all of his activities of daily living. So part of our thing with SSI really was also tied to being Medicaid eligible. While Adam was still in high school, we invited a VocRehab counselor to attend the 504 meetings. We knew he was college bound and we knew he would need support as he transitioned to adulthood. I remember having a million questions as there were many moving parts. While some of the questions were typical for all kids in high school, many more related to his disability. Where would he go to college? When does he apply for SSI? And can it help pay expenses while he's on campus? How will we hire caregivers and so on? One of our biggest concerns was that the transition from Katie Beckett to adult Medicaid be seamless and that his budget for personal care would be enough to cover his overnight hours. We were overwhelmed. There was a lot to learn and to put in place for Adam to be successful living on his own. We wanted to support his hopes and dreams as we would any of our children, but we were nervous as we tried to understand a complicated system. I knew that some of this couldn't be planned and that it would need to unfold a little at a time. We called a care conference at our son's pediatrician's office to bring the important players together to come up with an action plan. We needed support to do the things that needed to get done, and Adam needed to understand his role. We were eager to apply for SSI as it would come with the cash assistance and Medicaid, essential for his high medical and personal care needs. So close to his 18th birthday, he started the application, and after the phone interview, he was approved. We didn't know much about how SSI worked as a practical matter, but this was an important first step. We also chose to keep him in personal care services for children until his 21st birthday, just so we wouldn't have another big transition happening. We learned that SSI could be used toward his college room and board and would leave him a little spending money each month. He was learning to manage his finances independently. He understood the importance of using the SSI money so as not to accumulate assets in his bank account that would exceed $2,000. We encouraged Adam to follow his dreams with the college application process. After visiting Dartmouth, Princeton, and a few others, we were much relieved when he chose UVM, a mere half hour down the road with an excellent disability access office. We could get to him in an emergency, and it would simplify things as his Medicaid is specific to Vermont. Adam now had his SSI in place to help with living expenses. We had a commitment from VocRehab to assist paying for books and supplies up to $600 a semester. And he had a special budget from Children's Personal Care Services to accommodate overnight PCAs. Adam was also awarded work study. He held small jobs on campus while also juggling a full-time course schedule, participating in clubs on campus and enjoying time out with friends. He understood he would need to report monthly income to SSI and that this may decrease his benefits. Reporting income was a big responsibility for Adam and took some time for him to get used to. He wasn't always good at it either. And after several months, a letter came from SSI that they would be reducing his benefits until his overpayments had been resolved. This was a result of not always reporting. Still, he was working, and his plan always was that he was going to have a decent paying career when he graduated. We didn't care whether Adam's SSI money would be adjusted or even if he zeroed out his benefit. It was most important that we helped him achieve his dreams and not limit his goals. If in his career he made so much money that he was no longer eligible for SSI, that would be fine too, so long as he still had his Medicaid. Prior to turning 21, he did apply for adult services and Choices for Care program. We learned that he was eligible for long-term Medicaid, so this would cover him there. Keeping Medicaid was still essential. Medicaid pays for flex choices, it's his secondary insurance, and pays the premium to keep him on our private insurance. Adam lived on campus in the same accessible dorm room for 4 years with the assistance of his power wheelchair and a revolving staff of personal care attendants. He was engaged in all that campus life offered, and he was thriving. He graduated UVM in 2018 and started working full-time that summer as a research assistant to one of his environmental science professors at a wage of $20 an hour. This was in his field and would bolster his resume as he tried to build a career in the environmental field. To keep his bank account and assets below $2,000, Adam opened an ABLE account. The ABLE account has been an excellent tool to help him achieve his goals. He enjoys saving money, even if it comes with some limitations. Adam was learning to be financially literate and to balance the need between working and keeping his benefits in place. He has an ABLE account debit card that makes using his savings for qualified expenses easy. After a year, unfortunately, the grant funding ran out for that job and Adam was unemployed. He spent a lot of time looking for a new job in his field. He wanted to work and he had the energy to work. He loved contributing and having the camaraderie with people in his field. He would go to professional mixers to build relationships, became Passive House certified, and was being mentored by someone who did that work. He applied for jobs and went on interviews. He joined an unpaid advisory council for climate action in Vermont and continued with the Jericho Energy Task Force. He re-engaged with VocRehab and with Weber, who helped brainstorm ideas and tried to make possible employment connections. Unfortunately, all these efforts still did not lead to meaningful paid work. Concerned about loans coming due and not working, he filed a total and permanent disability claim to have his $25,000 of federal student loans discharged. He would now also be in a 3-year monitoring period. One requirement was that his income not exceed poverty wage for a family of 2, or about $17,000. He was aware that if he did find employment and had higher earnings, that his loans would be reinstated. We didn't see this as an issue. It was just another safety net that could be reversed and wouldn't necessarily limit his goals. Just recently, the Office for TPD, the Total Permanent Disability Claim, announced that they will no longer be monitoring income. So that's a big win. But of course we're in COVID, so that's not so good. But so he eventually found, through searches on his own, he found AmeriCorps, and he saw that they had a position at Resource Vermont, and he applied. They brought him on full-time to work in their office as a trainer for their programs. Part of the AmeriCorps service is that the wages are very low, but that he would also earn education credit. It kind of checked off all the boxes. gave him a place to go, and gave him some work to do, which he was very excited about. His life was very full as he kept up with the demands of a full-time job and enjoying a social life. He reported to SSI monthly. Then COVID hit and the office closed. Because Adam is very high risk for this virus, he's remained home sheltering since March 2020. He fulfilled his one-year service contract with AmeriCorps and signed on for a second, more limited term to continue the work he was enjoying, but doing it from home. That carried him through the first half of 21. Adam continues to work with Resource directly now on contract, but just for 10 hours a week. I think he'd still like to find something, a little bit more related to climate and doing the work that he was trained to do. But all of that's been pretty much put on hold because of COVID. And so that's kind of the big poo about it. And while he's still interested in finding more work, the uncertainty of the virus has put it on hold, as I mentioned. So he continues to look at ads and ponder his future. But for right now, we're just waiting out the pandemic. His limited work at 10 hours a week felt like a good balance for him for now. He did, however, recently receive a letter from SSA that he's earned enough work credit to be eligible for SSDI as well as SSI. Of course, now we have a million new questions, but at least we know who to call. So I make my benefits counselor my best friend at times. So very responsive and very helpful. Thanks so much.
Thank you very much, JoAnne, for sharing you and your son's story. Really appreciated hearing about his journey and how much your benefits counselor has helped you through these really challenging times also with COVID. So thank you very much for sharing, really.
Yeah, you're
welcome. So now I'd like to not only thank all the presenters, but I'd also like to talk about the call to action. You know, there are many opportunities and possibilities for people to explore the world of employment, careers, learning opportunities, and VocRehab is here to help explore opportunities. Next slide. So this is a great time, you know, for all of our viewers out there. Does anyone have questions? You're welcome to put them in the chat and I'd be happy to read them out. So we'll give everyone a few minutes to think about any questions they may have. On JoAnne's story, you can have questions about benefits, the SSI, all the information that you've learned today. It's a lot of information, but it's great that we know where to go to get help. We have a shy group here today. I'll give everyone a few more minutes. Any questions? Okay, we have a question. So when a student goes over the $2,040 per month or annual amount, does the 2-for-1 start right away? And assuming they do not, do the 2-for-1 on the $8,230? JoAnne, JoAnne Lemay, I think this one's for you.
Yeah, if I'm hopefully I understood the question correctly.
Do you want me to repeat it?
I think I've got it. And if I
Okay.
don't, just, yeah, please have the question asked again. So once the student does reach the annual limit, it does revert back to how they would count benefit, how they would count income if they were not on the student earned income. So yes, it would go back to the 1-for-2 counting once that has been reached. I don't know if that answered the question.
Thank you, JoAnne. And I'm hoping that answered the question. It looks like there's another one. And people can also unmute themselves. If they would like to unmute, they're welcome to also raise a hand and we'll call on you. I'll make sure I have a view of everyone. So if you want to unmute, any other questions out there? Or you can chat, you can put them in the chat box. Here's another one. Is there work incentives for youth that received SSDI? JoAnne, I think it's back to you.
So I'm assuming that you're meaning that has been redetermined at the age of 18, that they're now receiving an SSDI
Yes.
benefit?
Yes.
Okay. Yes, there are work incentives. There's actually several work incentives. And if you would like to talk about that, I would be extremely happy to talk about that, because there's extensive work incentives for SSDI to get into right now here. But I would be very, very happy to go through all of those if you'd like to give me a call.
Thank you, JoAnne. And here comes another one. Oh, they're coming in now. All right. How is the SSI application evaluated? Are the parents' assets income included?
No, when they're going for an age 18 redetermination, the parents' assets and income is not counted any longer. It's just based on the 18-year-old that is applying, or the person that's applying.
Okay, thank you. And I have a follow-up question. The earlier question was, is there work incentives for youth that received SSDI, which you had answered? And the next question from that same person is, are these the normal audit SSID incentives? Just curious.
I'm not quite understanding the question because I don't know what audit SSDI.
Okay. Are these the normal audit SSID? I wonder if they meant SSDI.
I think
Oh,
they
sorry,
mean
that
adult
was me.
SSDI.
Go ahead.
So I asked the question, and unfortunately I can't see the chat box when I'm typing, and I'm not the best spell corrector on typing. So my question is on the SSDI, is it the normal adult incentives that usually come with folks that are receiving SSDI and the adult over 18? Is it the normal incentives?
Yes, because they're receiving SSDI as an adult. They wouldn't get SSDI or a benefit off of a parent unless they were 18 or older. If they're under the age of 18, they don't get SSDI.
Great. Thank you so much for clarifying that.
You're welcome.
Thank you, JoAnne. Any other questions? I'm looking at the chat box, and I'm also looking at our audience to see if I see any hands raised, or you can unmute yourself and ask a question. A few more minutes. Quiet.
I think this one is obvious, but I'm just going to ask it. The 8230 is per year, regardless of how many jobs. It's not based off per job.
No, it's based on earnings, monthly earnings.
Total earnings. Okay.
Yeah, because I will actually give an example. I had a college student who did have 2 jobs, and he was earning over the monthly, he was earning in the $2,000 range. And we thought he was in this, I didn't know how much he was earning, Mom did, and I knew he was in the Student Earned Income Exclusion, and they got a letter stating that now he's in overpayment. And so what I found out is that within 4 months he had used up the Student Earned Income Exclusion, and then it reverts to whatever it would be after that. But for 4 months, he got to keep all of his SSI and income.
Yeah. So can a student go into the Medicaid for the working disabled if they earn out of their SSI check?
As long as they they remain medically disabled,
yeah,
they should be able to be eligible for Medicaid for the working disabled. As long as they haven't been found medically improved.
Okay.
And they're income eligible and resource eligible.
All those good things that come together with it, right? Yeah.
Right. Yeah.
Thank you, Michelle and JoAnne. So we have another question in the chat box. This is from Barbara Banley. You talk about redetermination at the age of 18 here. I will apply for SSI for my daughter when she's 18. Any advice or information about applying for SSI after 18 instead of a redetermination? And I can repeat that if you'd like.
So can I ask if they're already on an SSI benefit at this point right now?
I'm looking in the chat box to see if that person can respond, or they can raise their hand or unmute. No is the
Okay.
answer.
So an SSI redetermination is only if the child under the age of 18 was already receiving an SSI disability benefit. So that means, so at age 18, they're going to be redetermined as an adult at age 18. If after the age of 18, they were not receiving a benefit, they would just be applying for SSI in general, not a it would not be a redetermination.
Okay, thank you. I think people are thinking. Any other questions? I see that we do have in the chat box for folks, just to let people know, everyone who registered for today's workshop will receive an email with a link to the recording. Please do take a few minutes to complete the survey so we can make improvements and fulfill our grant requirements. Those surveys are really important for us. Our contact information is also there as well. Any other questions? I have a few other things I can add. Wait, I have a question from JoAnne Wechsler. Go ahead, JoAnne.
Hi, not a question, but just reflecting back, we didn't have any questions about SSI either until we had questions about SSI, like we didn't know what we didn't know until things were really, right there in front of us. And I tell you, it's, we didn't have, Adam was in and out of VocRehab, so we didn't always have access to a benefits counselor, which is how I connected with JoAnne Lemay, which was great and just so responsive and so helpful every step of the way when the questions arose. Thank you, thank you, thank you.
You're welcome. You're so
And
welcome.
the questions continue to arise, it's with the having work credit now. I mean, we didn't even know that was coming. So it's, we don't have the questions until it becomes an issue.
Well, give me a call.
Oh yeah, I think I already did.
You may be getting a lot of calls after this webinar.
Oh, I hope so.
Some folks did ask about the PowerPoint, that it is going to be sent to everyone. And I do have another question. Is Katie Beckett medical waiver also SSI?
I don't believe so, no.
I can
No.
answer that. That's just Medicaid.
It's just
Katie Beckett.
Right, and it goes,
It's a form of Medicaid, right? It's a form of Medicaid,
it's
but
a
it's
form
not.
of, it's a way to access Medicaid. Once it's just another way to access it that doesn't take into account the parents' income and resources. But you do have to have disability determination, and that goes through the state. So I think it's a slightly different process. It's the same office that makes the determination. I felt pretty confident going into SSI because my son had Katie Beckett before, and so I was pretty confident they would find him disabled again. Well,
thank you both, JoAnne. Unless we have any more questions, I am going to let folks know that we have lots of many more interesting workshops coming up, and you can find the details about those on our homepage on our website, which is vermontfamilynetwork.org, along with the links to all the previously recorded ones. We've got tons of information on our website, and getting connected with us is pretty easy. You can follow up on Facebook or join our closed Facebook page if you are a parent. We have two closed groups, one for all the parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. We have lots of archived, wonderful presentations. So if you get a few minutes, take a look. So thank you, everyone. This was great. I thank our presenters and for all of you who decided to watch our webinar today. If you have follow-up questions, I know that JoAnne would be happy to take those, and she did leave her information in the slide, so you're welcome to contact her. And thank you, everyone, for joining us today. Have a great day.
Thank you.
Bye.
Bye.